Here we are with the Platinum Foundation Notes Anatomy, and I am pleased to launch the inauguration of the Platinum Foundation Notes Anatomy. What it is, I would just like to explain that it is a book which is a high yield, highly targeted, important topics, most of the topics which are examiners' favorite, a book for MBBS students, a book for Neet PG aspirants, a book for Fmge aspirants, and it would cover most of the questions which are asked from an MCQ viewpoint, conceptual viewpoint, and as far as quick review for MBBS. Now, first of all, it will be ungrateful on my part not to recognize the contribution of Professor Jasmine Sheikh, who has been important, instrumental in framing, in advising, and in contributing to this book. And in addition to that, I would also be very much grateful to my team. I mean to say Dr. Kurat and Dr. Uzma, both of whom are very closely associated to me and who have done incredible work in this masterpiece. So, as far as this book is concerned, I'll be just taking you through the book, and you will appreciate, you will, I mean to say, go through and have a look at the various important things, how it is different from other books, what are the important features, the presentation, the skills which we have used in this book. So, first of all, I have taken all the aspects of the regionals of the anatomy, the embryology, all regions, and I mean, say upper limb, lower limb, thorax, abdomen, pelvis, perineum, head and neck, neuroanatomy, and I have not, I mean to say, missed embryology, I have not missed histology, I have not missed the clinical correlates which are there. So as far as the first topic is concerned, I'm just going through the rapids in the rapid sequence, various important topics which we have covered and which are very, very much important from a medical examiner's viewpoint, a student's viewpoint. You can see we started the embryology with the initial events in embryology, the time frame, first week, second week, fertilization, gastrulation, all the things which are there, implantation, I mean, say gastrulation, determination of sex, circulatory changes, changes in the circulation at birth, all important facts about the placenta, frequently asked placental membrane, abnormalities of the placenta, the umbilical cord, the development of the various important systems, the phrase, the brain, spinal cord, development of GIT in a very, very systematic manner, hepatobiliary system, development of pancreas, development of kidneys, development of, it's in a chronological and a systematic order, the development of prostate, diaphragm, all the things. And then what is important, once we study the NEET PG, questions are different from the way we studied MBBS. Why? And what has been asked recently has been put up in the form of flow charts, in the form of figures, in the form of diagrams. And that is why my team has been very, very much impressive in just taking out these questions, which are high yield, most frequently asked. I mean, say vaginal atresia, bicoordinate uterus, so many times asked. I mean, say double uterus with double vagina, horseshoe kidney. This was a question which was asked so many times, and I have given here a CT scan image of the things, what we mean by Meckel's diverticulum. The way, because image-based questions are also an important part of the MCQs, NEET, PG, FMG, INICET, qualifying examinations. So you can see meningocele, we have given it in a very, very systematic manner. Tracheoesophageal fistula, various important deformities of the nervous system, spina bifida, all the things which are important from an embryological perspective, omphalocele, gastroschisis, oligohydramnios, polyhydramnios, cryptorchidism, and then in addition to what is latest, the genes controlling embryogenesis, we have given them in a very systematic manner, the latest things which are asked. Then going to systemic anatomy, you see upper limb, what is important from an upper limb perspective, the vessels, the nerves, the veins, the lymphatics, with the important topics like the breast, whatsoever is important in the breast, the venous drainage, the lymphatic drainage, the arterial supply, the clinical implications of the breast CA, all important things which are there, which might not be given in other books. Then important things back. I mean, say this is all given in other books as well, but we have tried to condense it over here in a manner which is clinically important. So you can see all the things: Erb's palsy, Klumpke's palsy, claw hand, Horner syndrome, winging of scapula from upper limb, wrist drop, ape thumb deformity, nerve injuries in relation to humerus, the, I mean to say, the musculocutaneous stuff, the rotator cuff, what's all important, and muscles given in a tabulated manner, the cubital fossa, so many times asked, the relations at the cubital fossa, the vessels, the brachial artery, the dermatomal things, the muscles of the hand, are all important clinical palmar aponeurosis, Dupuytren's contraction, carpal tunnel syndrome, the spaces, their importance, the anatomical snub box, swinging of scapula, pulsating scapula, clipper field deformity, triangle of auscultation, rotator cuff tears, some things which are not given in other books. And this is the cash point of these books, that the yield of the questions in, I mean to say, the Neet PG examinations is very, very, very high. And that's why scaphoid fracture, trigger finger, mallet finger, what you expect at claw hand, ape thumb deformity, to mention a fib from all upper limb. So lower limb, all the things which are asked, petal plexus, housemate's knee, miner's beat knee, clergyman's knee. So things which need differentiation. This is something which sets this book apart from the other books. All the concepts we know as teachers why the students falter, why the scope of confusion exists, and we have tried to provide, I mean, say tables wherever needed. We have tried to provide figures wherever needed. We have to provide the text wherever needed, and given the correlates, surgical correlates, hernias, inguinal, femoral, what is important, popliteal fossa. I mean, say we have taken all the considerations as far as the student is concerned. We see students going through notes which are not that standard. We see students going through so much of a literature. There is so much of, but what is deficient? What are the gaps? Where the gaps exist? Those gaps we have tried to cover in all these, I mean to say, these topics. So you can see I'm taking you through, I'm just telling you something, and in the meanwhile, I'm scrolling down the text of my book. So you can see how beautifully we have presented the topics, and it is in line with the latest NMC criteria. Not only that, we have also taken into account the quantum of questions asked, a huge chunk of questions asked from anatomy, surgical anatomy, wherever we have, I mean, say, found that what is deficient and what is expected to be asked at, because many of the things which are there, and these things have been missed in so many books. So over here we have taken, now taking an example of the thorax. So we have taken up all the things which are in the thorax: rib fracture, stowing chest, flail chest, cervical rib, pneumothorax, hemothorax, cardiac tamponade, rupture of thoracic aorta, blunt injuries of the esophagus, bronchial injury, jugular notch, importance of sternal angle, funnel chest, pigeon chest. You will not find this collection invariably, because we have worked, it has been almost a 2-year project I have been working, and lately, I mean to say, in the last 1.5 years, Dr. Jasmine has added, I mean to say, our vital inputs along with Uzma and along with Kurat, and they have been fabulous, and they have all worked upon these things in a very systematic manner. So the diagrams have been, I mean, say, made by artists who have been perfected to the task to make them simple lines so that a student can just appreciate them and draw them themselves. These are not complicated figures which we have, I mean, say, incorporated in this book. It is not like an atlas, a Grant's atlas, which are hypothetical concepts as far as the student are concerned. I do not undermine the significance of these great books, but my point is that a student should be able to recap, draw in the examination, and know what's important as an MBBS student, and what is the role of this knowledge as far as, I mean to say, the Neet PG and Fmge is concerned. So giving a clinical tinge, a clinically applied aspect to the various important things which are there, that's more important, because we study sometimes vaguely. Some of the teachers do not have that insight to just tell a student what is important, what to study, how to study, the way to study, what is, I mean, say, more important for you. So, up till and unless we do not tell them the basic facts, neglect some of the unimportant things, although there is very less, I mean, say, substance which is unimportant. A medical student should have all the knowledge, especially about the basic sciences, anatomy, physiology, biochemistry, which are very important for especially anatomy, is very important for surgery, for ENT, for orthopedics, from radiological perspective, ENT perspective, and you cannot undermine the role of anatomy as far as these surgical allied specialities are concerned. So, as far as abdomen is concerned, we have, I mean, to say, made, say, we taken spleen, X-ray spleen, splenosis, polycystic disease of spleen, wandering spleen, torsion of spleen, autosplenectomy, splenomegaly, Kerr sign in relation to spleen, splenic flexure syndrome, splenorrhaphy, splenectomy, overwhelming post splenectomy infections. As an example, this can tell you how much we have just, say, condensed these things so that a student, at least a first MBBS student, gets a perspective why we study spleen, or for that matter, any other organ like stomach, pancreas, liver, gallbladder, extrahepatic biliary apparatus. And we have given almost all the clinical correlates which are there as far as these important, say, organ and organ systems are concerned. And we have tried to just simplify some of the diagrams. We have tried to get some questions which are image based, which have been recently asked, the differences where they exist, in the form of tables, in the form of charts, in the form of condensing the knowledge which is there. And this is not a, say, a book of 1,000 pages or so. We have tried to condense as much as we could possible to the max of our capability, and with valuable insights from the people I mentioned. They have been very helpful in just giving, say, shape to this book. And at some places, we have deleted some of the things which we found were not needed at this point of time. So as far as, say, the deletions and insertions are concerned, they had been taken into calculation, and maybe there might be some things which are, say, missing. We will try to rectify them hopefully in our next action, but this has been a sincere effort on our part, as you can see, to give an idea to the students what exactly this book is about. So I am scrolling down the page, and you can have a look at the things which have been beautifully presented, and we have not missed out pelvis, perineum, and we have given up all the, say, important things which exist there, which are important. Bat's plexus, ovaries, all the things related to uterus, supports of the uterus, prolapse of the uterus, the importance of perineal body, other important things. So to say that we have gone through the things, especially we have not missed much of the things which would be, say, worth mentioning. We have taken into account all the things which a student clinically should know, which a first MBBS student should know, and that is what we have tried to cover, so that a student from first MB just knows the importance of anatomy in their higher branches: ENT, neurosurgery, ENT surgery, orthopedic surgery, from a medical perspective, from a clinical perspective, whatsoever is there. And somewhere, some new technology, new terms, new, say, updates which have been there, we have incorporated those into that as well. And we have just taken the help of, say, students as well. The students have given us a feedback what they find missing in the other books, and that is what we have tried to, say, incorporate in here in a very simplistic manner. The diagrams have been drawn, say, in a very simplified line manner. These are not complicated diagrams which a student cannot afford to draw. Whether a student does not have good drawing skills, that would not be, say, of a much concern. We have tried to simplify all the things, so you can just see what we have just done, and how much of an effort it has been taken to condense all the topics which are there, and to just present them in the form of a single book, which is almost 350 pages to 400 pages. And depending upon, to say, the things how we have presented in the neuroanatomy as well, the latest things, the anterior cord syndrome, the central cord syndrome, the various important syndromes related to the midbrain, pons, medulla, what differentiates one thing from another, the important topography of the cerebrum, the way we just presented in the, say, simplistic manner, the various motor areas, the importance of the corpus callosum, all the fibers, then epithalamus, hypothalamus, the ventricular system of the brain, what a student needs to know, the clinical representation, the clinical images which you have there. I'm saying nothing to talk about the important topics like the blood supply of brain, blood supply of spinal cord, the optic pathway, the cranial nerves, which have been presented to the max of our, say, capability, in a manner which a student should know. So this is something which my team is proud of. They have worked upon it for a long period of time, and the result and the output you can see over here. So we have not missed histology, we have not missed embryology, we have placed all these things. And not only this, the histology does not cover only this thing. We have, in the end, we have just introduced a section, a clinical based clinical scenario section, and that's the cachet of the book, so that a student gets well acquainted with the cases, how the cases are asked, how the cases are presented, what should be your answer, how we arrive at the diagnosis of such cases. And this has been an effort from my team, and it has taken us 2 years. And I thank the team members for all the effort. And I hope that the students find these now only not only this, you can see we have got a clinical image based section in the book, and I am going through rapidly through these things, the CTs, the MRIs, the cross sectional studies, wherever the concept is involved, what we need from a student, how the student should be able to answer, what is likely asked. So we have covered all the aspects as we think and deem necessary for a student. And as yet, we have not, circulated the book, and we will be hopefully expecting a good feedback from especially the faculty, the anatomy faculty all over India. We have taken feedback though from many, prominent people around there who are academically brilliant, not the advertisers, not the, organizers or event organizers. We mean to say real academicians, academicians in real time. And I hope that their advice has helped us a lot, and we thank them for their advice, for their suggestions, and hopefully we will be, coming up across the next edition of this book, and that will be far more brilliant, I think. In case we find any deficiencies, we look forward to a critical, analysis from you, just encouraging us to do well and just pinpointing in case there are any mistakes, in case there are any deficiencies, any gaps. So that's it. I thank all of you for your suggestions and my team, and I hope that this book will be very useful for the students. I wish the students best of luck. They are the people who are for whom we have just taken this effort, and up till and unless it does not benefit our student community, we will not be satisfied. So I wish them best of luck for their examinations, and that's it. Thanks a lot.